Welcome to a deep dive where we explore how your brain and mental health are actually connected.
That's right. We're going to be exploring the fascinating field of psychobiology and how it applies to your future as nurses.
We'll be extracting some key insights from the book, Psychobiology of Mental Health Disorders.
This will be your secret weapon for understanding the biological foundations of mental illness.
Get ready for some aha moments as we explore how neurotransmitters, hormones, and even your genes can influence things like schizophrenia and depression.
And to help us break down some of the tougher concepts, we'll have a special expert guest joining us later in the show.
So to kick things off, let's start with the control center itself, the brain.
Right.
It's kind of like a supercomputer, isn't it?
It is.
Constantly processing emotions and thoughts and actions.
But instead of circuits and wires, we've got neurons firing and chemicals sending signals all throughout the brain.
Incredible.
It is.
But just like a computer has different components, the brain has distinct regions as well.
Yes, the forebrain, the midbrain, and the hindbrain, each with specialized functions.
So the forebrain, for instance, is like the CEO.
Yes, handling those higher-level thinking skills and emotional responses.
Okay, the forebrain is the boss.
You got it.
What about the other two? What are their roles in this intricate system?
Well, the midbrain is like the relay station,
Right.
connecting the forebrain to the hindbrain,
Okay,
which is responsible for those essential automatic functions like breathing and heart rate.
so kind of like the building's maintenance crew.
Yes, making sure everything runs smoothly.
I love these analogies. It definitely helps to picture it all working together.
Good.
But within these regions, are there specific areas that are particularly relevant to mental health?
Absolutely.
Okay.
Think about the limbic system. It's like the emotional hub of the brain processing feelings like fear and pleasure and anger.
Okay.
And within the limbic system, the amygdala acts as a sort of alarm system, triggering the fight or flight response when it senses danger.
So if a patient is experiencing intense anxiety, knowing that the amygdala is involved could help guide our approach and interventions.
Exactly. It helps you understand the biological underpinnings of their distress and tailor your care accordingly.
You wouldn't want to try to reason with someone whose amygdala is in overdrive.
No.
It's like trying to have a calm conversation during a fire drill.
Exactly.
That makes so much sense. So we've got the brain regions themselves,
Yes.
but what about those chemical messengers we keep hearing about?
Ah, yes, the neurotransmitters.
Right.
The stars of the psychobiology show.
Okay.
They're constantly zipping between neurons, carrying signals that influence mood and behavior, and even physical sensations.
Okay, let's meet these stars.
Okay.
I know there are a few key players, right?
You've got dopamine, which is all about pleasure and reward.
Okay.
Think of it as the brain's feel-good chemical.
Okay.
Then there's norepinephrine, which helps regulate alertness and arousal.
Okay.
It's kind of like your brain's morning coffee.
And I've heard of serotonin. Isn't that linked to mood?
Yes, it is.
Yeah.
Serotonin is like the mood regulator,
Uh-huh.
keeping things balanced and stable. Low levels of serotonin are linked to depression,
Okay.
which is why some medications like SSRIs aim to boost serotonin activity in the brain.
So SSRIs are like serotonin's personal assistants,
Yes.
making sure it gets where it needs to go.
Exact.
That's a great way to visualize it.
Uh-huh.
And then we have GABA,
Yes.
which acts like the brain's brakes.
That's right. Slowing things down, promoting relaxation.
Okay. And lastly, there's glutamate.
Yes. Glutamate is involved in learning and memory, kind of like the brain's note taker.
Wow, so many different neurotransmitters, each with its own unique role.
It's a very complex system.
But what happens when they get out of balance?
That's when we start to see mental health conditions emerge.
Okay.
For example, in schizophrenia, we see an excess of dopamine in certain brain areas, which might contribute to those hallmark positive symptoms like hallucinations and delusions.
So it's not just the presence or absence of these chemicals. It's also about the right amount in the right place at the right time.
Precisely.
It's a delicate balance, and when it's disrupted, it can have profound effects on a person's mental health.
Yes, it can.
This is already so fascinating, and I'm starting to see how understanding these biological processes can really impact how we approach patient care as nurses.
It's all connected.
Yeah.
And we haven't even touched upon the role of hormones and the endocrine system yet.
Right.
Another critical player in this intricate dance.
Okay, let's dive into that next.
Okay.
The endocrine system.
Yes.
What role does it play in all of this?
Well, think of the endocrine system as a communication network that uses hormones as its messengers.
Okay.
These hormones travel through the bloodstream, influencing various bodily functions, including mood, sleep, and even appetite.
So it's like another layer of complexity,
Yes.
adding to the fascinating symphony of the brain and body.
Exactly.
And one of the key players in this system is the HPA axis.
Yes, the hypothalamic pituitary adrenal axis.
Oh, the HPA axis. I've heard of that, but it always seemed a bit mysterious.
It's actually quite fascinating when you experience stress. The hypothalamus, a tiny region in your brain, sends a signal to the pituitary gland, which then triggers the adrenal glands to release cortisol,
Oh,
infamous stress hormone.
so it's like a chain reaction
Yes,
triggered by stress.
precisely. And cortisol is incredibly important for survival. It helps you cope with immediate threats by increasing energy, raising blood pressure, and sharpening focus. The problem is when that stress response becomes chronic.
Right. If the HPA axis is constantly firing, it's bound to have negative consequences.
Exactly. Chronic stress can lead to elevated cortisol levels, which have been linked to a whole host of mental health issues, including anxiety, depression, and even PTSD. It can also disrupt sleep, impair cognitive function, and weaken the immune system. It's a domino effect.
Wow. So that's why managing stress is so crucial for mental well-being. It's not just about feeling better, it's about protecting our brains and bodies from the damaging effects of chronic stress.
Exactly, and that's where your role as a nurse comes in.
Right.
By understanding the HPA axis and the impact of stress, you can help your patients develop healthy coping mechanisms, advocate for stress-reducing interventions, and provide education about the mind-body connection.
It's about empowering patients to take charge of their mental health and giving them the tools to navigate those challenging situations.
Precisely. And speaking of tools, there's another powerful force at play here: genetics.
Yes. Genetics are a blueprint for life. But how does it fit into the picture of mental health?
Well, while genes aren't destiny, they certainly play a role in our predisposition to mental illness. Twin and adoption studies have shown strong hereditary links in conditions like schizophrenia, bipolar disorder, and major depression.
So if a patient has a family history of mental illness, it's something we need to be aware of during our assessment, right?
Absolutely.
Helps us identify potential risks and vulnerabilities.
It's a piece of the puzzle, and it helps us understand the biological factors that might be contributing to a patient's current state. It also underscores the importance of early intervention and preventative measures for individuals with a family history of these conditions.
It's about identifying those red flags and offering support and resources before things escalate.
Exactly, and it's important to remember that genetics is a complex field, and research is always evolving. New discoveries are being made all the time, deepening our understanding of how genes interact with environmental factors to influence mental health.
It's fascinating and a bit overwhelming to think about all these intricate processes happening within our brains and bodies. It's like a constant dance between biology, environment, and experience.
It is, and there's another fascinating layer to this dance that we haven't explored yet: the mind-body connection.
Oh yes, the mind-body connection. It's something we hear a lot about. But what does it actually mean in the context of psychobiology?
Well, it refers to the intricate ways in which our mental and emotional states can influence our physical health and vice versa.
So it's like a two-way street,
Yes.
with thoughts and feelings impacting the body and bodily sensations feeding back into our emotional state.
Exactly. And this is where the field of psychoneuroimmunology, or PNI, comes in.
Oh,
PNI explores the connections between the nervous system, the endocrine system, and the immune system.
so it's like a super system,
Yes.
connecting our brains, our hormones, and our body's defenses.
Precisely. And research in PNI has shown that chronic stress, for example, can weaken the immune system, making us more susceptible to infections and other illnesses.
And that makes sense. When we're stressed, we often feel run down and more likely to get sick.
Exactly. And on the flip side, chronic inflammation, which is part of the immune response, has been linked to conditions like depression and anxiety.
So it's a complex interplay with mental and physical health constantly influencing each other.
It is. And as nurses, you'll have the opportunity to witness these connections firsthand and provide care that addresses the whole person, not just their symptoms.
It's about recognizing that mind and body are inextricably linked and that true healing requires a holistic approach.
Precisely. And to help us delve deeper into some of these complex concepts, we have a special guest joining us today.
That's right. We're thrilled to welcome Dr. Sarah Thompson, a leading expert in the field of neuroimaging. Dr. Thompson, thanks for being here.
Dr. Thompson, we've been discussing the intricate workings of the brain and its connection to mental health.
We're particularly interested in learning more about how neuroimaging techniques like fMRI are helping us visualize and study these processes.
We know this is a complex topic,
Yes.
so we're hoping you can break it down for us and our listeners.
Welcome, Dr. Thompson. Can you give us a brief overview of what neuroimaging is and how it's being used in the field of psychiatry?
Of course, neuroimaging is like taking a peek inside the brain, allowing us to see its structure and function in real time.
Oh, that
fMRI, or functional magnetic resonance imaging, is one of the most commonly used techniques. It measures brain activity by detecting changes in blood flow. So when a certain area of the brain is active, it requires more blood, and fMRI picks up on that signal.
That's incredible. So we can actually see which parts of the brain light up when someone is thinking or feeling or even experiencing symptoms of a mental health disorder.
Exactly. It's revolutionized our understanding of the brain and mental illness. For example, in schizophrenia,
Hmm.
fMRI studies have shown reduced activity in the prefrontal cortex, an area involved in planning, decision-making, and working memory.
Which makes sense considering the cognitive difficulties we often see in individuals with schizophrenia.
Precisely. And in depression, we see altered activity in the limbic system, particularly the amygdala and hippocampus, which are involved in emotional processing and memory.
So neuroimaging is providing tangible evidence of those brain-based changes that underlie these complex disorders. It's not just theoretical anymore. We can actually see it happening.
It's powerful, isn't it? And it's not just about diagnosis. Neuroimaging is also helping us understand how different treatments work. For example, we can see how antidepressants impact brain activity and how therapy can actually change the structure and function of the brain over time.
That's so encouraging. It shows that we can actually rewire those neural pathways and promote healing.
Exactly. It's a testament to the brain's plasticity and its ability to adapt and change throughout life.
Dr. Thompson, before we let you go, is there any particular area of research in neuroimaging that you're particularly excited about? What are some of the frontiers in this field?
Oh, there's so many exciting developments. One area that's particularly promising is the use of machine learning algorithms to analyze neuroimaging data.
Yeah. Yeah.
This can help us identify subtle patterns and predict treatment outcomes with greater accuracy.
Wow, that sounds like the future of personalized medicine tailored to each individual's unique brain.
It is. And another area that's gaining momentum is the study of brain connectivity, how different brain regions communicate with each other. This can provide valuable insights into the complex interplay of neural networks that underlie mental health.
It's mind-blowing to think about all the mysteries we're still unraveling within the brain.
Yeah.
Dr. Thompson, thank you so much for sharing your expertise with us. This has been incredibly illuminating.
Thank you for having me. It's always a pleasure to talk about the wonders of the brain.
And now, armed with this newfound knowledge about the brain, neurotransmitters, hormones, genetics, and even the mind-body connection, let's dive into specific mental health conditions and explore how these biological factors contribute to their development and influence their treatment.
It's like having a behind-the-scenes pass to the theater of the mind.
Exactly. So first up, let's tackle a complex and often misunderstood condition, schizophrenia.
Okay, schizophrenia is a chronic mental illness that affects how people think, feel, and behave. It's characterized by a range of symptoms, often categorized as positive, negative, and cognitive.
What's the difference between those categories? It sounds like there's a lot going on.
There is positive symptoms are those that are added to a person's experience, things like hallucinations, delusions, and disorganized thinking.
So those are the experiences that aren't typically present in someone without schizophrenia.
Exactly. Negative symptoms, on the other hand, refer to a decrease or absence of normal emotions and behaviors. This can include things like flat affect, lack of motivation, and social withdrawal.
It's like dimming of the light, a loss of that spark that makes us human.
It can be incredibly debilitating, and then there are the cognitive symptoms which affect thinking, learning, and memory. This can include difficulty concentrating, making decisions, and remembering things.
So schizophrenia is really a multifaceted disorder affecting various aspects of a person's life, but what's happening in the brain to cause all of these symptoms?
Well, as we discussed earlier, dopamine plays a key role. The dopamine hypothesis suggests that an excess of dopamine in certain brain areas, particularly the mesolimbic pathway, contributes to the positive symptoms.
So too much dopamine in the wrong place can lead to those hallucinations and delusions.
Exactly, and research also points to reduced levels of glutamate, another neurotransmitter in schizophrenia. This might explain some of the negative symptoms like flat affect and social withdrawal.
Fascinating how these subtle chemical imbalances can have such profound effects on behavior and experience.
It is, and that's why antipsychotic medications are a cornerstone of treatment for schizophrenia. They work by blocking dopamine receptors, essentially trying to rebalance those neurotransmitter levels.
So they're like dopamine regulators calming down that overactivity in certain brain circuits.
Precisely. And there are different types of antipsychotic medications, each with its own mechanism of action and potential side effects. First generation antipsychotics like haloperidol and chlorpromazine are effective at reducing positive symptoms, but they can cause significant side effects, including movement disorders.
That sounds concerning. Are there other options that have fewer side effects?
There are second-generation antipsychotics like risperidone, olanzapine, quetiapine, ziprasidone, aripiprazole, paliperidone, acinapine, iloperidone, lurasidone, and cariprazine were developed to have a lower risk of those movement side effects, but they can have metabolic side effects like weight gain and increased risk of diabetes.
So it's a balancing act, finding the right medication and dosage to manage symptoms while minimizing side effects.
Exactly. And that's where your role as a nurse is so important. You'll be monitoring patients, closely educating them about potential side effects, and advocating for adjustments to their treatment plan as needed.
It's about being a vigilant advocate for your patients and ensuring their well-being.
Precisely. And it's not just about medication therapy. Social support and lifestyle modifications are all crucial components of a comprehensive treatment plan for schizophrenia.
It's about addressing the whole person, not just their symptoms. What about those other biological factors we discussed earlier? Do they play a role in schizophrenia as well?
They do. We know that genetics plays a significant role. Having a close relative with schizophrenia significantly increases your risk of developing the disorder.
So family history is definitely something to consider during our assessment.
Absolutely. And there's growing evidence that prenatal factors like maternal infections and nutritional deficiencies during pregnancy might also contribute to the development of schizophrenia.
So it's a complex interplay of genes and environment shaping the brain's development.
It is, and as nurses, understanding these biological underpinnings can help you provide more informed and compassionate care to your patients with schizophrenia.
It's about seeing the person behind the diagnosis, recognizing their struggles, and supporting them on their journey toward recovery.
Exactly. And speaking of journeys, let's shift our focus to another challenging but treatable condition, depression.
Depression, a word that carries so much weight and affects so many people. It can manifest in so many different ways, from persistent sadness to loss of interest in things that once brought joy.
It can be debilitating, affecting not just mood, but also energy levels, sleep appetite, and even cognitive function.
Then biologically, what's happening in the brain to cause this cascade of symptoms?
Well, we know that those neurotransmitters we talked about earlier, serotonin, norepinephrine, and dopamine, play key roles in depression. We see reduced levels of these neurotransmitters, particularly in areas of the brain involved in mood regulation, motivation, and reward.
So it's like the brain's chemical messengers aren't getting their messages across effectively.
Exactly. And this can lead to those hallmark symptoms of depression, the persistent sadness, the loss of interest, the fatigue, the difficulty concentrating.
And that's where antidepressants come in, right?
Yeah.
To help boost those neurotransmitter levels.
Precisely. There are several classes of antidepressants, each targeting those neurotransmitters in slightly different ways. We've got SSRIs like fluoxetine, Prozac, sertraline, Zoloft, paroxetine, Paxil, citalopram, Celexa, and escitalopram Lexapro, which specifically increase serotonin levels.
And what about norepinephrine and dopamine? Are there medications that target those neurotransmitters as well?
There are SNRIs like venlafaxine Effexor and duloxetine Cymbalta, increase both serotonin and norepinephrine levels. And then there are tricyclic antidepressants like amitriptyline Elavil and imipramine tofranil, which affect multiple neurotransmitters, but they tend to have more side effects.
So many options, each with its own set of benefits and risks.
Exactly. And let's not forget about MAOIs or monoamine oxidase inhibitors like phenylzine and tranylcypromine parnate. They work by inhibiting an enzyme that breaks down neurotransmitters, increasing their availability in the brain. However, MAOIs require dietary restrictions and can interact with certain medications.
It sounds like finding the right antidepressant is a bit of a trial and error process requiring careful monitoring and collaboration between the patient and their healthcare provider.
It is, and it's important to remember that medication is just one piece of the puzzle. Therapy, lifestyle changes, and social support are all crucial components of a holistic treatment plan for depression.
It's about addressing the whole person, not just their symptoms.
Exactly. And speaking of the whole person, we can't forget about the role of the HPA axis and those stress hormones we discussed earlier.
Right, chronic stress can really fuel the fire of depression, can it?
It can when we're chronically stressed. That HPA axis is constantly activated, leading to elevated cortisol levels, which can disrupt mood, sleep, and even brain function.
So it's like a vicious cycle with stress feeding the depression and the depression making it harder to cope with stress.
Precisely. And that's why stress management techniques like mindfulness, meditation, and yoga can be so beneficial for individuals with depression.
It's about giving them tools to regulate their nervous system and break free from that cycle of stress.
Exactly. And what's fascinating is that exercise has been shown to have antidepressant effects as well.
Really? How does that work?
Well, exercise increases levels of endorphins, those natural mood boosters, and it also promotes the growth of new brain cells in the hippocampus, an area involved in mood regulation.
So moving our bodies can actually help heal our minds.
It can, and let's not forget about the importance of sleep. Sleep deprivation can exacerbate depression, while getting enough restful sleep can improve mood and cognitive function.
It's all connected, isn't it? Our physical health, our mental health, our behaviors, our environment. It's a complex tapestry.
It is, and as nurses, you'll have the privilege of helping your patients weave that tapestry back together, guiding them toward healing and wholeness.
It's about empowering them to take charge of their mental health and providing compassionate support along the way.
Exactly. Now, ready for another adventure in the realm of mood disorders? Let's explore bipolar disorder, a condition characterized by dramatic shifts in mood from the highs of mania to the lows of depression.
Bipolar disorder, it's often portrayed in movies and TV shows, but the reality is far more complex and challenging than those portrayals often suggest.
And it's a chronic illness that requires ongoing management and support.
And biologically, what's driving those extreme mood swings, what's happening in the brain?
Well, as you might expect, those neurotransmitters we've been talking about are involved during manic episodes. We see an increase in norepinephrine and dopamine, those neurotransmitters associated with energy, excitement, and reward.
So it's like the brain's accelerator is stuck in overdrive, leading to those feelings of euphoria, racing thoughts, and impulsive behaviors.
Exactly. And then during depressive episodes, those neurotransmitter levels plummet, leading to feelings of sadness, hopelessness, and low energy.
It's a roller coaster of brain chemistry, and it can be incredibly disorienting and distressing for the individual experiencing it.
It can. And that's where mood stabilizers come in lithium. A classic mood stabilizer is thought to help regulate those neurotransmitter fluctuations, preventing both manic and depressive episodes.
So lithium is like a balancing force, helping to smooth out those extreme highs and lows.
Exactly. And there are other mood stabilizers as well, like valproic acid, depakote lamotrigine, lamictal carbamazepine tegretol, and oxcarbazepine trileptal. They each have their own mechanisms of action and potential side effects, so finding the right medication and dosage for each patient is essential.
It's about personalized medicine, tailoring the treatment to the individual's needs and circumstances.
Precisely. And as with any medication, close monitoring for side effects is crucial. Lithium, for example, can affect thyroid and kidney function, so regular blood tests are necessary.
It's about balancing the benefits of mood stabilization with the potential risks of medication side effects.
Exactly. And again, it's important to emphasize that medication is just one part of a comprehensive treatment plan for bipolar disorder therapy, particularly cognitive behavioral therapy. CBT can help individuals identify triggers, develop coping mechanisms, and manage stress, which can help prevent mood episodes.
It's about empowering them to take an active role in their recovery.
Precisely. And let's not forget about the importance of social support. Having a strong network of family and friends can provide invaluable emotional support and encouragement for individuals navigating the challenges of bipolar disorder.
It's a reminder that we're not alone in this journey.
Exactly. Now, ready to explore the world of anxiety disorders. These are incredibly common, affecting millions of people worldwide.
Anxiety, that feeling of unease, worry, or fear that can range from mild to debilitating. We all experience anxiety from time to time, but when it becomes persistent and interferes with our daily lives, it's a sign that something more might be going on.
Exactly. And biologically, we see a lot of activity in the brain's fear circuitry, particularly the amygdala and the hippocampus.
Right, the amygdala, our brain's alarm system, seems to be on high alert in anxiety disorders, doesn't it?
It does. And the hippocampus, which plays a role in memory, can contribute to those intrusive thoughts and flashbacks that often accompany anxiety.
So it's like the brain is stuck in a loop of fear and worry.
Exactly. And those neurotransmitters we've been talking about, particularly GABA and norepinephrine, play key roles in anxiety disorders.
GABA, our brain's calming agent, and norepinephrine, our fight-or-flight responder. What's happening with them?
Well, in anxiety disorders, we see a deficiency of GABA and an excess of norepinephrine.
So the brakes aren't working properly, and the gas pedal is stuck down, leading to that feeling of being constantly on edge.
A perfect analogy, and that's where anti-anxiety medications come, and benzodiazepines like alprazolam Xanax and lorazepam Ativan work by enhancing the effects of GABA, calming down that overactivity in the brain.
So they're like temporary tranquilizers, helping to ease those anxious feelings.
Exactly. But benzodiazepines can be habit-forming, so they're typically prescribed for short-term use.
That makes sense. We wouldn't want someone to become dependent on them. Are there other options for long-term anxiety management?
There are SSRIs and SNRIs, which we discussed earlier in the context of depression, are also effective in treating anxiety disorders. They work by increasing serotonin and norepinephrine levels, which can have mood-stabilizing and calming effects.
So those medications can be helpful for both mood and anxiety disorders.
They can, and there's another class of medications called buspirone busbar that's specifically approved for generalized anxiety disorder. It works differently than benzodiazepines and doesn't have the same risk of dependence.
It's good to know so many options to consider depending on the individual's needs and the severity of their anxiety.
Exactly. And again, medication is just one piece of the puzzle therapy, particularly cognitive behavioral therapy. CBT can be incredibly effective for anxiety disorders.
How does CBT help with anxiety?
CBT helps individuals identify and challenge those negative thought patterns and develop coping mechanisms to manage anxiety-provoking situations.
So it's about rewiring those thought patterns and building resilience.
Exactly. And lifestyle modifications like regular exercise, stress management techniques, and getting enough sleep can also play a significant role in managing anxiety.
It's about empowering individuals to take control of their mental health and make positive changes in their lives.
Precisely. Now let's shift gears and talk about a group of disorders that are often misunderstood and stigmatized: eating disorders.
Eating disorders, they're complex and often life-threatening conditions that affect people of all ages, genders, and backgrounds.
They're characterized by a distorted body image, an intense fear of gaining weight, and unhealthy eating behaviors.
And biologically, what's contributing to these distorted thoughts and behaviors?
Well, we see a lot of activity in the brain's reward circuitry, particularly the dopamine system in individuals with eating disorders. Food restriction can actually trigger a release of dopamine, creating a sense of reward and reinforcement for those unhealthy behaviors.
So it's like a hijacking of the brain's reward system where starvation becomes addictive.
Exactly. And we also see dysregulation of other neurotransmitters like serotonin and norepinephrine, which can contribute to mood disturbances, anxiety, and obsessive-compulsive behaviors often seen in eating disorders.
It's a complex interplay of brain chemistry, psychological factors, and societal pressures.
It is, and treating eating disorders requires a multidisciplinary approach, addressing both the physical and psychological aspects of these conditions.
What does that typically involve?
It often includes nutritional counseling to restore healthy eating habits therapy, to address underlying psychological issues and develop coping mechanisms, and sometimes medication to manage co-occurring conditions like anxiety or depression.
It's about providing a holistic approach, addressing the whole person, not just their eating behaviors.
Exactly, and it's important to remember that recovery from an eating disorder is a journey, and it can take time and support.
It's about providing a safe and compassionate space for healing and growth.
Precisely. Now, before we wrap up our exploration of the biological underpinnings of mental health disorders, let's take a moment to acknowledge the profound impact of trauma on the brain and body.
Trauma. It's a word that evokes images of physical injury. But trauma can also be emotional, psychological, and even societal.
Exactly, and trauma can have lasting effects on the brain, particularly the amygdala, hippocampus, and prefrontal cortex.
Those are key areas involved in fear processing, memory, and executive function. How does trauma impact them?
Well, in individuals who have experienced trauma, the amygdala can become hyperactive, leading to an exaggerated fear response and a constant state of hypervigilance.
So it's like the brain is constantly on guard, scanning for danger, even when there's no immediate threat.
Exactly. And the hippocampus, which plays a role in memory consolidation, can be impaired, leading to difficulty forming new memories and retrieving old ones.
That makes sense, considering how trauma can fragment our sense of time and make it hard to piece together a coherent narrative.
It does, and the prefrontal cortex, which is involved in planning, decision-making, and emotional regulation, can also be affected, leading to impulsivity, difficulty concentrating, and emotional dysregulation.
So trauma can really disrupt those higher-level cognitive functions that help us navigate the world effectively.
It can, and this is why trauma-informed care is so crucial.
What does trauma-informed care look like?
It's an approach that recognizes the widespread impact of trauma and seeks to create a safe and supportive environment for healing. It involves understanding the signs and symptoms of trauma, responding to individuals with sensitivity and compassion, and empowering them to regain a sense of control and agency.
It's about recognizing the deep wounds that trauma can inflict and providing care that honors the individual's resilience and capacity for healing.
Precisely. And there are specific therapies like eye movement desensitization and reprocessing EMDR and trauma-focused cognitive behavioral therapy, TFCBT, that have been shown to be effective in treating trauma-related disorders.
So there's hope for healing even in the face of profound adversity.
There is, and as nurses, you'll play a vital role in supporting individuals on their journey of healing from trauma.
It's about creating a space of safety, understanding, and empowerment.
Exactly. Now, before we move on to our final segment where we'll explore the exciting frontiers of psychobiology and the future of mental health care, let's take a moment to reflect on the incredible complexity and interconnectedness of the brain and body.
It's truly awe-inspiring to consider all the intricate processes happening within us, orchestrating our thoughts, emotions, behaviors, and even our physical health.
It is, and as nurses, you have the privilege of witnessing this incredible symphony of life unfold every day.
It's a responsibility we don't take lightly.
And with that in mind, let's dive into the future of psychobiology and the exciting possibilities that lie ahead.
It feels like we've only just scratched the surface of all this stuff.
Yeah.
Where do you see psychobiology heading in the future? What are some of the breakthroughs we can look forward to?
It's a really exciting time to be working in this field. One area that's generating a lot of buzz is personalized medicine,
Okay.
tailoring treatments to an individual's unique genetic and biological profile.
So instead of a one-size-fits-all approach, we're moving towards treatments that are more targeted and effective for each individual person.
Exactly. Imagine a future where we can use genetic testing to predict how someone will respond to certain medications.
That would be amazing.
Right. We could avoid those trial and error periods and minimize side effects.
That would be revolutionary.
Yeah,
It would completely change how we approach mental health care.
it would. And another area that's rapidly advancing is the development of new non-invasive brain stimulation techniques like transcranial magnetic stimulation or TMS and transcranial direct current stimulation, TDCS.
I've heard of TMS, but can you refresh my memory on exactly how it works and what conditions it's used for?
Sure, TMS uses magnetic pulses to stimulate specific areas of the brain.
Okay.
It's been shown to be effective in treating depression, anxiety, and even chronic pain.
So it's like a non-invasive way to modulate brain activity and promote healing.
Exactly. And TDCS uses a low-level electrical current to stimulate the brain. It's still in the early stages of research, but it shows promise for treating a range of conditions, including depression, addiction, and even stroke rehabilitation.
It's incredible to think about the potential of these non-invasive techniques to alleviate suffering and improve quality of life.
It is, and as nurses, you'll be at the forefront of these advancements, administering these therapies and educating patients about their benefits and risks.
It's so exciting to think about the role nurses will play in shaping the future of mental health care.
It is, and let's not forget about the growing field of psychobiotics, the study of how gut bacteria can influence brain health and mental well-being.
Wait, gut bacteria, what do they have to do with our brains?
Yeah. It might sound strange, but there's a growing body of evidence suggesting that the trillions of bacteria living in our gut can actually communicate with our brain through the gut-brain axis.
So what we eat and the health of our gut can actually impact our mood, our thoughts, and even our behavior.
Exactly. Research is showing that imbalances in gut bacteria, known as dysbiosis, have been linked to conditions like anxiety, depression, and even autism spectrum disorder.
That's fascinating. So could probiotics or dietary changes potentially play a role in treating mental health conditions?
That's what researchers are currently exploring. It's still early days, but there's a lot of interest in the potential of psychobiotics to modulate gut bacteria and improve mental health.
It's mind-boggling to think about all the connections we're discovering between our physical health, our gut, and our brain. It really highlights the importance of a holistic approach to well-being.
It does, and as nurses, you'll have the opportunity to educate your patients about these connections and empower them to make choices that support both their physical and mental health.
It's about being partners in their healing journey, guiding them toward a state of wholeness.
Exactly, and remember, the field of psychobiology is constantly evolving. New discoveries are being made all the time, deepening our understanding of the brain and mental health.
It's an invitation to never stop learning, to stay curious, and to embrace the complexities of this incredible field.
And to use that knowledge to provide compassionate and effective care to your patients.
To see the person behind the diagnosis, to honor their experiences, and to support them on their journey towards mental wellness.
That's the heart of nursing care.
And with that inspiring thought, we come to the end of our deep dive into the psychobiology of mental health disorders. We hope you found it enlightening, empowering, and maybe even a little bit mind-blowing.
Remember, knowledge is power, and you now have a powerful toolkit to help you navigate the complexities of mental health care.
Keep learning, keep exploring, and keep making a difference in the lives of your patients. You have the potential to be true agents of healing and hope.